Hi there, I'm Dr. Heather Harrison. I'm a family physician at the Central Utah Clinic in Provo, and today we're talking about the risk of donating eggs. So being an egg donor, when you think about that, the risks of it include risks of infection, because obviously they've got to poke a hole in you in order to get those eggs out. There's risks associated with the medications that they use to induce ovulation and produce an extra amount of eggs so that there's multiple that they can go in there and get. The medications that they use to induce what we call a superovulation, the risks of those medicines or side effects include nausea, breast tenderness, abdominal pain. Sometimes you can get pretty enlargement of the ovary itself, and it can cause pretty significant pain. Usually, ibuprofen, Tylenol. Sometimes they may have to prescribe some stronger medications to help out the discomfort, but most of the time ibuprofen, Tylenol should help out with those side effects or symptoms from the medications. Again, the procedure itself, they have to use, they do under sterile technique to decrease risk of infection, because again, they have to go in and actually retrieve those eggs from the ovaries, which under ultrasound guidance, we go in and remove those eggs. Again, because they're poking a hole in you, there's the risk of infection. You may receive antibiotics to help to decrease that risk of infection, and sometimes they may put you on some anti-inflammatory medications or steroids to help to decrease inflammation from the procedure as well. So I'd say the biggest risk with donating eggs are the side effects from the medication and then the risk of the procedure with infection and inflammation, but those usually seem to be well controlled with just over-the-counter medications or antibiotics to help to prevent those. And this is Dr. Heather Harrison talking about donating eggs.